Dr. Golden, good to be here with you today. What is ALS?
Yes. So ALS is motor neuron disease. It is a form of motor neuron disease and the most common acquired motor neuron disease in adults. It is a disease of the motor neurons in the brain and the spinal cord. So there's a two-part system for movement in your body. There's the neuron in the brain that triggers the movement, sends the signal down, and then the neuron that lives in the spinal cord that then travels out to the muscle to trigger a movement. And both of those neurons are diseased in ALS.
So is this something that sort of moves through the nervous system, or it sticks in one place?
It can move through, it does move through. It can start in various locations. So the most typical onset is called limb onset ALS. It starts in either a hand or a foot, and the motor neurons to that hand or that foot start to degenerate slowly over time, progressively, causing weakness and atrophy or muscle loss in the hand. Then it tends to spread to the other hand or the other foot, then elsewhere in the body.
You mentioned before this interview that you have diagnosed ALS before. What goes into diagnosing ALS, and how easy is it to diagnose? Can it be complicated?
It can be. It is what we call a clinical diagnosis. So there is no single lab test out there that gives you a thumbs up or a thumbs down. You have ALS, you do not have ALS. So it consists of a sit down with the patient, taking a history, saying, when did your problem start? How has it progressed over time? What parts of your body are involved? What are your symptoms? Then examining the patient, looking for those signs like weakness of the muscle, shrinkage of the muscle, twitching of the muscles, and their reflexes, which are typically kind of jumpier or more active than usual. Then, based on that history and that examination, you form your differential. So you say, I think this could be these different types of diseases, and obviously ALS would be on that list, and you say, what can I do to confirm or deny anything else that it could be? So that can involve lab tests in the blood, that involves an electric nerve and muscle test called a nerve conduction study and EMG, and occasionally something a little more complicated like a spinal tap or a genetic test. And using all of that information, the physician has to come to the conclusion of whether this is consistent with ALS or not.
So going off of that, when should folks go and see a medical professional?
In general, whenever you have a symptom that worries you. Specifically for ALS, it's weakness. It's typically painless, progressive weakness is what's going to tip somebody off that ALS could be in the differential. Obviously, if you have weakness associated with other things, it probably still needs to be checked out, but for ALS, it's the painless, progressive weakness is the key.
And what are the treatments?
So there are currently 3 FDA-approved treatments. None of them are fantastic. It's a very, very active area of research. The oldest one and kind of our mainstay that we have right now is Riluzole, which has been around for a couple of decades. It slows the progression of the disease somewhat, can extend survival by 2 to 3 months or longer, typically is well tolerated. We use it very commonly. A more recently approved one was Edaravone, which was initially an IV infusion but is now available by mouth. Can slow the progression in a smaller subset of patients, usually patients who have earlier stages of the disease. Most recently, and really excitingly, there's one called Tofersen, which is not for all ALS patients, but specifically ALS patients with a genetic mutation, a specific genetic mutation in a gene called SOD1. And this is kind of bringing us into this era of more targeted therapies for specific kinds of ALS to try to specifically target what is going on in a particular patient.
You go through the drugs. You mentioned that you don't feel they're fantastic. What makes you say that?
Riluzole, our longest standing drug, The typically quoted statistic is extending survival by 2 to 3 months out of a typical survival of 2 to 5 years. Now, real world experience sometimes says that maybe that's a little longer, and you can never guess in a particular patient if they're going to be incredibly responsive to it or not. But it's far from a cure.
And let me go off of that. Do you think there'll ever be a cure?
Maybe. I'm certainly hopeful. I think the targeted therapies are very exciting for the particular genetic mutations. I think the more we go along, the more we learn that ALS is not one monolithic disease. Different patients have different reasons why their neurons are degenerating, and I think the more we learn about the specifics of that, the more we can work on targeted therapies that I'm very hopeful will be a cure.
What can these treatments mean, for quality of life, and how do they can they, extend a lifespan?
Yes, so they can extend survival by some number of months. They can extend the quality, by slowing the progression of the disease. That may mean that someone gets to walk independently a little longer. It may mean that they're swallowing independently a little longer, that they're doing without assistance to breathe for a little longer, and having that time to, live their life, interact with their family.
And of course, we're talking during ALS Awareness Month, and there's also other forms to bring awareness to the disease. The Ice Bucket Challenge is a famous example. What do you think that means for knowledge of the disease in general?
I hope that it is something that stays at the forefront of people's brains so that they understand the importance of funding for scientific research, because it costs a lot of money to do these studies and to learn new things about this disease and to bring a drug from its earliest stages of development to market. There is so much manpower and scientific power and patient participation. I think that when people think of scientific funding, it can be a very vague, abstract thing, but when you start to think about real cases of people that who are benefiting from this or who could have benefited from something, then I think it's important.